Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, a cardiologist. In this presentation, we are going to look at 2D echocardiogram, basic views. You can follow with my arrow here. Here's the arrow. And you can follow with my arrow. We're going to look at the left parasternal long axis, apical four-chamber, which is the flat plane, horizontal plane. Then we have two-chamber looking at the left side of the heart. These are the three basic ones, and in addition to these we have multiple other views, but in this presentation we're going to focus upon these three and how much anatomy and structure and function we can evaluate just based on these three views. So let's look at the first thing is a parasternal long axis, which is where the transducer is placed along the axis that is pointing towards the right shoulder, and these are the structures that we see. And here we have the aorta, and behind that is the left atrium. Then we have the interventricular septum, we have the left ventricular inferior wall, then we have the right ventricular wall here, right ventricular cavity, we have the papillary muscle, the chordae, and we have the mitral leaflets. Then we have the left atrium. Here we also see the coronary sinus. In an echocardiogram, it's varying shades of gray, and as we can see, the same structures are replicated here. Here's the aortic root, here's the aortic leaflet, then we have the mitral leaflets, then chordae. We don't see the papillary muscle here. Here is the epicardium, the dark white, the bright white one, and here's the endocardium. Then same thing here, the septum. This is the right ventricle, this is the left atrium. And based upon just looking at this, we can deduct a lot of information. We can look for left ventricular hypertrophy, pericardial effusion, left atrial enlargement, right ventricular enlargement, mitral valve structures, mitral annular calcification, and a number of other things can be determined, especially with video loops, where we can see motion, wall motions, and any abnormalities related to the wall motion. And the next one is a parasternal short axis at the aortic root level, where we see the aortic valves, and this sign looks like a Mercedes-Benz sign. These are the three aortic leaflets. This is the left coronary cusp, this is the right coronary cusp, and this is a non-coronary cusp. And here we have the right ventricular outflow tract, tricuspid valve, right atrium, left atrium, and here we have the pulmonic valve. In this view, we can look for pulmonic regurgitation, tricuspid regurgitation, left atrial size, aortic regurgitation, where we see a mosaic pattern in the pulse Doppler, and we also look at the right atrial size. Along with that, we will be able to determine pulmonary pressure as to whether the person has pulmonary hypertension or not. So not only we look at the anatomical structures, by adding Doppler we can determine a lot of information about this view. And here we have the interatrial septum. Sometimes we can use contrast to or bubble studies to look for intracardiac shunts. Sometimes if there's a dissection, we can see a double barrel lumen in the aortic region, and that may be a sign of aortic dissection. Okay, let's move on to the apical four-chamber view, where a lot of information is gathered anatomically, structurally, functionally, and also looking for anything in and around the heart itself. So let's start off with the apical four-chamber view. Cuts through the right ventricular wall, the anteroseptal region, then we have the infralateral wall of the left ventricle, then we have the left atrium here. Here's the interatrial septum. Here we have the right atrium. This is the tricuspid valve, and this is the right ventricular cavity, and here we have the right ventricular wall. By just looking at the size of the atria compared to the left ventricle, you can see if there's left atrial enlargement or right atrial enlargement. We can look at this tricuspid valve attachments to determine if that person has Epstein's anomaly, where the tricuspid valve is attached way down into the ventricular cavity. So here is a mitral annulus, and we can look for mitral annular calcification, especially in the lateral side. We can also look at the mitral leaflets for any evidence for mitral stenosis or thickening of the mitral leaflets or mitral valve prolapse. Left atrial enlargement is a very important, significant factor, especially in patients with left ventricular elevated diastolic pressure. We can look at the wall cavity size. We can look at the wall motion. We can look for any aneurysms. We can look for any defects like interatrial septal defect or interventricular septal defect, and also look at the wall motions when we are playing a video. In addition to that, we also have these pulmonary veins where we can do a pulse Doppler to look for any evidence of elevated left ventricular end diastolic pressure. So, ladies and gentlemen, this is a actual echocardiogram which doesn't look as crisp as this diagrammatic image shown here, but nonetheless this is how we get pictures in real life, and we have to work with it. Sometimes we may not be able to see the endocardium very well to look for wall motion abnormalities. Anyway, this is the infralateral region. This is the anteroseptal region of the ventricle, and this is the mitral valve posterior leaflet. This is the anterior leaflets. Here tricuspid we have the septal leaflet, and here we have the anterior tricuspid leaflet. Then we have the pulmonary veins here, right superior pulmonary vein, left superior pulmonary vein, and of course the interatrial septum. And you can look at the size of the cavity of the left ventricle and left atrium, right ventricle, right atrium, to see if there's any evidence of hypertrophy or cardiomyopathy, dilated cardiomyopathy. And here's a different picture which is explaining all the various structures. And here we have the sept apex, and here's a very nice delineation of the endocardium, as you can see here. And we have the left ventricular free wall. We can look for pericardial effusions. Beyond that, we can also look for pleural effusions. And here's the anterior mitral leaflet. This is the posterior mitral leaflet. We have the mitral annulus here. Then we have the left superior pulmonary vein, right superior pulmonary vein, where we can do the Dopplers, and here's the interatrial septum and the tricuspid valve. So, ladies and gentlemen, this is a quick overview of the 4-chamber view. Now let's turn our attention to the 2-chamber view, which is another important view that is used especially looking for wall motion abnormalities. In the 2-chamber view, it basically cuts through the anterior wall of the left ventricle and the inferior wall of the left ventricle. So, and here we have the mitral valve. By looking at this, especially when we use contrast, we can look for the anterior wall motion or the inferior wall motion. We can also look at the left atrial size, but mainly this is used for looking at the left ventricular size and function, and look for any wall motion abnormalities. So this is another 4-chamber view looking at anatomic structures, comparing with the diagrams here, especially looking at the pulmonary veins. As you can see, here's the left atrium, and here we have these pulmonary veins draining into the left atrium, and we can put Doppler here to look for pulmonary vein Doppler, which helps us to identify any presence of elevated left ventricular end diastolic pressure. Thank you so much for watching this presentation, and I will see you in the next presentation. Please do subscribe to our YouTube channel. Thank you so much.